Hello everyone and welcome to this Electa webinar. The topic of today's presentation is using innovation to address physician burnout. My name is Tom Chadwick. I'm the Senior Business Marketing Manager for Electa Software. Physician burnout is definitely on the increase. I think this is something that we're seeing this everywhere in many modern publications. I think really the pace of modern healthcare is really one of the key factors that contributes to physician burnout. In the last 3 years, the advisory board indicated that there's been approximately a 30% increase over the last 3 years. And this has major effects when you consider that it's directly linked to decreases in patient satisfaction, increases in reported medical errors, increased physician turnover, and also early retirement on behalf of physicians. A recent Medscape survey was done of 15,000 practicing physicians, and nearly 2/3 of them reported either feeling burnt out, depressed, or even a combination of both. They also suggested that to alleviate some of these burnout feelings, they suggested that physicians should be tasked with fewer bureaucratic activities and spend less time working. And I think if we look at the what a major problem this is, there was a study that was done in Healthcare Dive, which is a kind of an industry publication or website, and they attributed that this physician burnout issue costs the industry as much as $1.7 billion per year. And a lot of the burnout is directly related to also, the type of electronic medical records that physicians are tasked with using. A lot of times these are designed with more with billing rather than patient care in mind. And this article that I cited in the Atlantic magazine from May indicated that there are even physicians that are actually using the electronic systems, but also maintain a duplicate system, a hand-written notes to be able to manage their patient care. So that that's a pretty clear message that a lot of the electronic medical records that are currently in practice are not user-friendly and don't allow for efficient patient care. So there's a number of factors really that contribute to physician burnout. As I mentioned before, almost 56% of it is related to bureaucratic tasks, related to charting and paperwork, also spending too many hours at the hospital or at the office also contributes to physician burnout. And there are a number of other things as well that contribute to physician burnout. But essentially, if you kind of combine them, I think a lot of physicians feel emotionally exhausted after dealing with this bureaucracy and a lot of these systems. The feeling of having, increased regulatory burden, especially with programs like MIPS and MACRA, those type of things. The lack of clinical autonomy, so being able to make their own decisions, or instead of making their own decisions, being dictated or regulated on how they need to practice medicine, and essentially, being overextended and undervalued. So all of these really contribute to physician burnout. There was a study that was done at the Cleveland Clinic by Dr. Amy Windover, and what she did was she actually surveyed just over 1,500 physicians, of which she was able to get a pretty high response rate of 75%, or 1,145 physicians. And of that study, 35%, or almost 400 physicians, met the criteria as being burnt out. And she goes on to conclude that a lot of this stems from the administrative tasks associated with patient care. And she also adds that physicians who need burnout interventions aren't likely going to be identified by low patient satisfaction scores. So there's other factors that contribute to that, but it's very difficult to be able to determine which physicians are experiencing the burnout symptoms. So I think there's a number of ways that we can address this sort of crisis going on within healthcare. I think providing opportunities for physicians to provide feedback and also to recognize the contribution that physicians provide really in the front lines of healthcare. They need to be definitely more involved in decision making, and also the physicians that are identified as having symptoms of physician burnout need to be provided some support as well to help overcome these issues before they progress any further. And also, we'd also like to propose that there are different technologies that can help alleviate some of the bureaucratic workload and administrative effort that physicians have to face in their day-to-day activities. And one of these technologies is Palabra. And for those that are not familiar with Palabra, what it is a voice automation for directly for Mosaic, and it provides the ability for full automation. It allows for complete reverse EMR capabilities for Mosaic, and the output is perfect notes. So essentially what this can provide physicians and healthcare enterprises is a really dramatic turnaround on the documentation and the administrative creation of reports. In studies that were done at a number of sites, they were able to reduce the transcription turnaround from between 4 and 14 days to generally within 1 to 3 days. So some of the benefits are that physicians are not required to be doing double entry. You're allowed, or you can dictate immediately, and it creates the note directly on the fly, and it can be distributed to the referring physician or to the hospital EMR or Mosaic immediately. So the net result is a very quick, very accurate, very complete documentation very quickly. So prior to Palabra, there's a lot of challenges with physicians having to manage yesterday's technology, or challenges with the EMRs, dealing with all of this information, struggling with these systems, and all of these really contribute to creating physician burnout. This is prior to Palabra, but essentially what Palabra does is it has very tight Mosaic integration. It allows for really a seamless continuum between the voice transcription and the Mosaic EMR. So essentially there's, as I mentioned, very tight integration. The system was developed by an ex-Electa engineer who understands the database structure of Mosaic very well, and is able to integrate the Palabra system directly within Mosaic. The system also has very powerful templates that allow physicians to be able to dictate very quickly and utilize these templates to generate a very comprehensive note very quickly. And then as well, the system is also integrated very highly within with Dragon and M-Modal. So these are really the engines behind the Palabra system, but it's really the tight Mosaic integration that really provides the key value here in making it efficient. So essentially, there's a number of things that can be done with Palabra. It allows physicians to be able to manage all of this information, calling their patients, starting their notes, completing their notes, fully navigating through Mosaic, copying, converting, and adding information directly into your documentation, all by use of your voice. So there's less clicking, less pecking with the keyboard, and essentially it's a much more efficient, much more natural, and much more faster method to create these notes. So very quickly, just kind of a snapshot of how the system works is that the system will simply by using the voice commands like follow-up note for Stephen McDonald, it will actually pull the information directly from the Mosaic system and jump between different areas that it needs to create this note. So you can actually replace and add new information. You can use the magic snip to obtain images and and actually import those images directly into your note. And then again, this is all done through voice commands. And as well, you can enter the different quality measures that are important to be documenting, especially for the MIPS and macro type programs. And then all of this automatically transfers into Mosaic without with voice commands. As well, you can actually work with the assessments, the orders, the QCLs, schedules, all entirely through simple voice commands. So it's much more efficient, much quicker to use, and much more effortless. So really, by combining both Mosaic and Palabra, it provides really the voice-based note creation, voice-based data entry. It allows the ability to use favorites and insert images, and allows you to also use OCR to be able to use character recognition from scan text and import that directly into Mosaic, and then also use this reverse EHR functionality to command the system. So this is really the only voice-enabled electronic medical record in oncology. So with us on the line here today, we have Dr. Kevin Becker from Maimonides Medical Center. For those of you that aren't familiar with Maimonides, it is the largest medical center in New York. It's located in Brooklyn, New York. And Dr. Becker has actually been kind enough to share some of his time and his experiences with Palabra with us. So Dr. Becker, thank you for joining us today.
My pleasure.
So first, I'd just like to ask you a few questions regarding your use of Palabra, but before we kind of get into that, maybe you could just provide some comment on the whole issue of physician burnout and, you know, as a clinician, what your experience has been with that.
Sure. I think that most of us physicians in the field have felt this increasing burden of administrative tasks over the years that's just been accumulating. And many of my colleagues note that it seems like there are administrators and regulatory bodies just keep adding tasks for us to do, never taking anything away, and that there comes a breaking point, and all of us feel like we're always maybe beyond the breaking point. So from meaningful use and MIPS to the just sort of legal requirements of documentation and trying to protect yourself in your practice. I think a lot of us feel like we spend much more time documenting than we would like to, and that's a big source of the dissatisfaction that a lot of physicians feel.
So is it a typical thing for you or your colleagues to be spending sort of the early hours of the evening documenting the day's clinical activities, or is that something that occurs?
Or late evening hours and weekends. I think that for most of us, we spend most of the day with patient care, and it's really into the evening and weekend hours that documentation had gotten pushed, and that's obviously not a happy situation for most.
Right. So, and I understand that you've been using Palabra for a couple of years, since approximately 2016. Can you maybe comment on how that's affected some of these administrative, or generating a lot of this documentation post your clinical day? Has that had a positive effect?
Yeah, it's really been for me an incredible change. It really, I can do a note now in a fraction of the time that it takes without Palabra. And even more than the time itself that it saves, it's taking away a lot of the effort that was really not clinical or intellectual in any way. It's the clicking that is just mindless, and especially when you're, there in the office at 7:30 and want to be at home eating dinner, the fact that you have to click 5 times to approve a note or open a note is part of what's sort of soul killing and is taken away by Palabra. And so it was sort of for me, a threshold effect where prior to Palabra, after having seen 20 or 25 patients in a very busy clinic day, you finish up returning some calls and it's 6 o'clock, and to finish all the notes for the day would take another hour, maybe 2 hours. So you just either you don't do it, you say that you're going to do it after you get home because you have remote access, or you're going to do it this weekend, and the notes accumulate. With Palabra, it cut it down to a threshold where you can just, stay another half an hour and get all of the notes done for the day. And obviously when you're doing them on the day that you saw the patient, as opposed to having jotted down some notes on that, parallel written summary that you're going to go back to and write a complete note later, it just goes much faster. It's more efficient. It's more accurate. And you get it done that day, as opposed to always playing catch up because you got behind with a very busy day.
So, can you comment as well on the turnaround time, sort of pre-Palabra and post-Palabra? And I guess what I'm kind of interested in understanding is, I would expect previously there would have been the whole transcription exercise where you would dictate and then it would be transcribed, then you would have to review it and then make corrections, and then I would expect that it would take a certain amount of time to be able to complete and generate and I guess deliver the document to referring physicians. Can you maybe comment on what life was like before Palabra and what life is like after Palabra?
Sure. So, for myself, before Palabra, I would dictate and send for transcription all of the new consults because we were starting from scratch. On average, I'd say probably those got completed and sent out about a week after the visit. And I would say that the lack of efficiency there was you spend the time to dictate the note. A week later, you get the dictation back 24 hours later, but you might not have time to actually review it then. So a few days later, you finally have time to review it. You've now forgotten much of it. You're having to go over the whole note again to make sure that it was transcribed accurately, as opposed to now most of the time you're dictating it on the day of, and it's ready to be approved that day and sent out that day or the next day.
So would you comment as with respect to the comprehensiveness of the Palabra note versus the other prior notes? I would expect that if you're doing it immediately after seeing the patient, then a lot of these things would be top of mind and probably would contribute to a more comprehensive note.
Yeah, I definitely think that in the past there were things that I noted on exam or issues that came up and we addressed that sometimes would get left out of notes just because there was a time delay between being able to document everything and when you actually saw the patient. I'd also say some of the, I really like the snip feature. We use that with imaging sometimes. So, when I've got our PACS images up of CAT scans that I was looking at to see the patient anyway, it's a couple seconds for me to actually cut that image and put it into the note to send to a referring physician that might not be in our hospital system. And there are times, you have a really great response to your chemotherapy, the tumors disappeared, and they can actually see that in the note, and it really took seconds to do it. I think that a lot of the referring physicians like that, and something that I never would have done before.
So I would imagine that would be impossible to do really with a transcription-based system. Is that correct?
Yeah, that's correct.
So, and maybe you can also comment on your colleagues and how they've, what their sort of impressions are with respect to Palabra.
It's been very popular. So all of our medical oncologists are on the system, as well as our NPs and PAs, and I think it really has made a big difference in terms of reducing the amount of time that people are spending on documentation. And when you can relieve that burden, I think that people really appreciate it. It also sort of sends a message that the hospital administration understands that burden. I think it's been one of the few times in my recent memory where we've been able to do something to reduce administrative burdens. I feel like it's always been, as I mentioned, one thing after another added on. And this was nice to actually take a step back and make it easier. I feel like that hasn't happened often.
So, and then maybe could you talk, if you've got, so this is very widely deployed through, your busy clinical facility. Can you comment a little bit on the training and like how long does it take to be proficient in Palabra? Or, and I would expect, your colleagues, you probably have both younger and older fellow physicians that may have varying levels of computer expertise. And can you comment on how they were able to adapt to the system as well?
Yeah, the on-site training was excellent and really personalized to everyone and their comfort with IT. I think it really is not something that's dependent on anyone's really comfort with IT. It's pretty user-friendly. There is a little ramp-up period, but I think it's relatively short while your notes are sort of being formatted and getting into the Palabra templates. But I'd say that that's over with in a week at most. And I think that there are lots of higher level features in terms of making favorites and getting all the functionality that people can continue to improve and use, but getting 90% of the benefit and getting comfortable with using it, I would say happens within a week and was pretty uniform with just about everyone in our group.
That's great. So do you think that overall you've seen a benefit with respect to workflow efficiencies with Palabra?
Yeah, absolutely. Before we had Palabra, so we were monitoring within the practice, how many notes were outstanding, not approved, and sent off to referring physicians, and we saw it reduced by about 90% after Palabra, and I think a big part of it was one, just the absolute decrease in the time that it takes, and two, just making it now doable to do within a day, the notes of the patients that you saw, whereas seeing a high volume of patients, it wasn't before.
Can you comment as well? Has there been any effect on reimbursement or with respect to billing, so being able to complete the you know, the documentation quicker to receive payment faster? Is it? Do you know anything regarding that?
I don't know about faster. I do know that, you know, prior to Palabra, we were often chasing after physicians. You know, we're about to hit the window of when this will no longer be a charge that we can send out, and that almost never happens now.
So would you say that it's probably helped it's probably helped alleviate some of the billing errors then?
Yeah, absolutely.
Okay. Okay. Well, I think that's pretty well all the questions I had. Are there any other comments you'd like to make before we kind of wrap things up?
No, I think we've covered most of it. I think that, as I said, not only is it a big improvement in terms of reducing the time spent doing one of the most unpopular tasks in medical care right now, but I think it also is sort of a sign of understanding of the situation that doctors are in right now to take this step to do something to relieve their burden and to focus their efforts more on patient care and away from documentation.
That's great. Well, thank you very much for taking the time out of your busy clinical day to speak with us. I really appreciate it, and you know, thank you to all of the participants online as well too. Thank you for taking time out of your busy days to listen to this. This recording will be posted on Support Plus. If there's any other questions, feel free to reach out to me. My email address is tom.chadwick, CHADWICK, @electric.com. So with that, I'd like to conclude things. Thank you again, Dr. Becker, and enjoy the rest of your day.
Thanks, Tom.